The entire industry, both on the payment side and on the provider side, has been in a consolidation mode for the last 10 years. This was accelerated by the enactment of the ACA. Private equity is now interested because certain organizations have attained critical mass, and those are mainly the publicly traded ones. With respect to the provider side of things, for the most part, there are impediments and barriers to entry because many of these provider systems are nonprofit. So private equity investors have been figuring out ways to partner with these nonprofit systems in a way that still gives them the returns on equity that they require. They normally have a 3 to 5 year window and have some degree of certainty as to where they think the particular market segment is going. With healthcare, that's a little less certain. The most unique challenge is that when they want to invest on the provider side of the equation, they have the challenges of nonprofit. And the challenges of nonprofit are that these entities are set up for the public good, and the aim of a private equity investor, which is to make an entity more efficient, more marketable, take it to market in a 5 to 7 year window, is somewhat antithetical to the original intent behind the creation of nonprofit hospitals. So what I see having to happen over the next few years is a middle ground that's created between the needs of private equity investment and the nonprofit entities that are protected by the attorneys general in various states. What we've seen as a vehicle for entry into these nonprofit providers is a management arrangement. But the management arrangement, which has to be approved by the state regulators, is limited in terms of the compensation that flows back to the equity investors in the manager. So they have inherent limitations on the returns on investment that their investors demand.